morning, and welcome to Wednesdays with Darren and Cindy, where we bring you real conversation about things that affect our lives and the community. My name is Cindy Ward,
And my name is Darren Powell.
and we are going to be your host for our podcast.
Mood disorders are a group of mental illnesses characterized by a drastic change in mood. Depression and anxiety are two of the most common mood disorders that can affect anyone at any time. However, military service members and their families are particularly high risk for developing these type of conditions. Recent studies show that 14% of service members experience depression or anxiety after a deployment. However, this number can be even higher because some service members don't seek care for their condition.
Well, on today's podcast, we have with us a special guest, Lieutenant Colonel Blake, and he's going to give us some insight into depression and anxiety in the military community and give us some practical tips to manage and function these common disorders. Good morning, Lieutenant Colonel Blake. Can you please introduce yourself? Give us your background.
So, good morning, everyone. I've been a social worker for the past 10 years. I attended the Army Fayetteville State University Master's in Social Work program. So, this program was initiated by the Army to kind of meet the shortfalls for behavioral health therapists in the Army. And after graduating in 2010, the Army also has a social work internship program, and so I completed that at Brooke Army Medical Center for 2 years. And at that time, my supervisor was Dr. Patterson. He was the one of the prior consultants for the Army social work AOC, and so it was great to be under his tutelage, and he always said, I want to make you a therapist that I would be comfortable with my family or friends.
Nice.
I would want you to be confident. I want to feel confident that I could send them to you. So that's kind of my background. Wanted to also say that my wife's a social worker too, and so we often have in-depth conversations about mental illness.
I can imagine what the conversations are like in that household.
The kids are probably the ones that have the roughest
I know.
time. I know.
Yeah, the kids are like, boundaries, what are boundaries?
Wow.
Yeah. Okay. Anxiety and depression. These are kind of overused, and everybody's a therapist when it comes to anxiety and depression. Everybody's diagnosing everybody. But in layman's terms, can you define anxiety and depression?
Yes, I would say that anxiety and depression, they are periods of time where someone's thoughts become disordered. And I would say that it's primarily focused on, for example, anxiety. You may have a tendency to overestimate dangers, have a lot of maybe some irrational fears, diminish your own belief in yourself to handle some of these threats and concerns. And, in that process, if you're always kind of living in a state of danger, your stress response is going to remain elevated. And so, you're always going to be scanning your environment, anticipating that something awful or bad is going to happen. I would say with depression, the thought content is not so much fear-based, but loss-based. You're focused more so on, a sense of loss of, things that maybe you wanted to do, or maybe there was some past trauma that, has affected you, and there's a pretty predominant thought of loss. And then, a tendency, I would say for depression is to awfulize and when I say awfulize, to look at your current situation and just see it in a very negative way. And there could be lots of positive things going on, but just the way that you are connecting the dots in your mind, you're just looking at everything is bad.
So anxiety and depression both are inward, and they're basically, they start in your brain. Both of them.
In your brain, you're essentially just conditioned to either be on the sense of high alert, and that there's lots of fear and overestimation of danger from an anxiety point of view, and then for depression, just an overwhelming sense of everything is bad. And in the midst of contradicting evidence that things are going well, it's hard to see the positive side of stuff.
Wow.
That's good. Yeah. Could you talk about a little bit about the old stigmas around mental health in the military, and tell us where we're at today in that?
Well, I would like to actually say that we have really made some leaps and bounds with stigma, but from my perspective, there's still a great deal of work that needs to be done with stigma in the military. I like to think of mental illness just as very similar to a physical illness. But the old models that people have about mental illness just hasn't really caught up with the science. The science is that there is just like someone who has a heart condition,
right.
You can have a mental condition, and but it's often looked upon that the person has some kind of character flaw or some defect that is within their control, and it is not within their control, and that's why you need a therapist to kind of help tease out whether this is something that's an illness, or is this something that's just an injury.
That's a good, that I like the way you describe that. And going along those lines, can you tell us some of the symptoms that somebody who might be dealing with depression may have that might be persistent, and they don't even realize that they have they have depression because the symptoms are so persistent and they just deal with it?
Right. I mean, off the back, loss of interest, just no energy to want to participate in life. They would isolate themselves. Someone who says that I'm feeling depressed, but sitting in front of the TV all day and not really having an opportunity to feel something positive. So there's a lot of isolation, loss of energy to just participate in life and have something good happen. There may be increased alcohol consumption, and it's just, if you're already depressed, you're thinking that you want to feel better, and then you choose to consume alcohol. It's a depressant. So but that's the paradox of the illness, is that you are trying to cope to in essence feel good, but you're actually moving along the continuum of just trying to avoid feeling bad. And so
That's good. That's
Wow.
good. That's well said. Yeah. Wow. Tell us a little bit about anxiety and how it could fit into the military mission, and also how it could be damaging.
So, anxiety on one hand is good because it is preparing you for a challenge. But I guess it's how you frame it, if it's a challenge or a problem. So anxiety is mobilizing your resources, kind of getting you prepared for whatever stressor you got that you're looking or anticipating. But then, your circumstances change. If you're getting ready to deploy, obviously you probably need to have your stress response is activated because
Right.
you're getting ready to go into harm's way.
Mm-hmm.
But what happens if it gets stuck on?
Oh.
When people come back from deployment and they need to have these, a wider range of emotional expression to be able to connect with family and loved ones, and you're just stuck in this hypervigilant avoidance state,
Whoa.
then again, you're conditioned. We do a really good job of conditioning our soldiers, but we don't do a really good job of kind of recalibrating when they come back. And so, you're operating in a combat setting where you need to be hyper vigilant. But then when you come back, you don't necessarily need to be hyper vigilant when you're around crowds at the mall.
That's true.
And going out to a restaurant and sitting with your back against the wall and scanning, for potential threats. That probably is out of context.
Well, can you tell our listeners some of the physical effects of dealing with depression and anxiety?
Well, the physical effects, let's say for anxiety, is that if you're always on a state of high readiness, then you're gonna eventually get to a point where you're tired and fatigued. Your body's just not designed to stay at that high level of exertion, and so with chronic stress, that's just going to break down your body. Heart issues, stomach problems, ulcers, and so it's just a breakdown, I would say, of your vital body organs and stuff if you maintain that. And so people kind of come in with inability to breathe properly because they're so stuck on high alert that you're not breathing, you're not getting that deep breath. And then I often think of it as holding your breath for a protracted period of time, and we know that that's not good.
Not good.
And you're not going to be able to think clearly if you're suffocating yourself. But oftentimes people are just breathing very shallow, and that just becomes their steady state for existence. I would say for depression, fluctuations in your appetite. I would say that more likely you're probably going to gain weight just because you're not as active in life, and so you're just kind of sitting around existing in this kind of dark state, and then you continue to drink alcohol and so forth, and alcohol is a toxin, and so that's breaking you down too, and maybe you're smoking and putting nicotine in your body, and so I think it's about having healthy life habits to handle the ups and downs so that you don't necessarily pick poor unhealthy habits.
Oh, good. That's a great transition to our next question. And the next question is, do you have any tips for people who may be dealing with kind of depression at a moderate level and they might want to try to manage it themselves, and just things lifestyle? You talked about lifestyle and some tips that maybe might be beneficial to a person who's dealing with anxiety or depression.
Right. So I when I'm treating patients, I often go to the cognitive theory of your thoughts determine your emotion. And so for someone who is, for example, having depression, depending on the intensity of your appraisal of whatever situation, so I often say if you lose $5, not a big deal. your appraisal is probably like, okay, I can recover from that. If you lose $5 million,
That's
different.
That's different.
Your appraisal of that is probably going to be pretty intense. Like,
right.
oh my God, how am I going to make up for this? And so you can be sort of, just, a little disappointed about, losing something minimal. You lose your iPhone or your cat card, your appraisal is going to be a little more intense. So if you lose $5 million, you're probably going to be despondent and not necessarily looking forward to living a good life unless you can kind of reframe that in some positive way. And so, it's really recognizing sort of the patterns that you have. So, awfulizing or catastrophizing, so when I look at someone who has anxiety, they have a tendency to catastrophize about the future, like it's not going to work out.
True.
Someone who has depression, they're awfulizing or catastrophizing about right now. Like I can't see my way out of this moment. And so so wanting to understand sort of these problematic patterns of thinking, and then also having the patient start to challenge some of their irrational thoughts. So what's the evidence for this automatic thought? What's the evidence for and against? Is this a habit, or is this or are my thoughts based off of fact? And so it can be hard to discriminate between your irrational thoughts and fact. It's easy to make judgments about our reality and
That's
not
true.
necessarily base it off of the facts of the situation.
Right.
So that's and that process is called the ABC model. A is for an event, B is your appraisal, your automatic thought, and the automatic appraisals that we don't have much control over those. That's based off of who we are as individuals, what our childhood experience has taught us, and then based off how we think about it is going to determine how we feel, and how we feel is going to determine how we behave, the choices in terms of our behavior.
It's
Well, so say for instance you have a family member that's noticing these patterns, but the person themselves are not noticing the patterns. So what would you say to that family member if that person is suffering in denial with one of these disorders and not getting the help that they need?
So great question. And so that would be a good situation, because you definitely want to be surrounded with someone that's going to help you reality test. So if you have a supportive family member and they are repeatedly kind of bringing things up, that is in some way helping you to challenge maybe your current thinking about the situation. And so I would encourage a family member who does have someone that cares about them, that's sort of bringing concerns like, hey man, you're drinking a lot, or you're just kind of moping around the house doing nothing. These are their observations, and hopefully we can kind of get to the fact of the matter. Is this just an interpretation, or is this fact? And so, kind of taking that seriously if there seems to be a lot of, feedback that things aren't quite right.
Yeah, that's good. Okay, this is an interesting question, and I'm sure a lot of our listeners are because we hear about meds every day, and some people have different rules of thought on meds. Could you talk a little bit about that? The need for meds, the dangers of meds, some of the misconceptions around meds.
Right. There's a lot of stigma about medications.
Yes, there is.
But I think if we can truly appreciate that everyone is wired differently, that it's not anything wrong. It just means that's just how you've been designed physically. And so if there is uh, um, a situation where your body is just not producing serotonin in the sufficient quantities to be able to feel good, then are you just going to say that you can will your way to feel good when on a molecular level you don't have the hardware to produce the serotonin? So our bodies are a machine, and so just like you take your car in for maintenance, you need to take your body in for maintenance. And if it's determined that you need some type of fix in terms of medication to help you have the hardware to feel better, then I think that would be, it's indicated. You have someone with some expertise that kind of can help you, guide you through the process. Now, it's not a very precise science because you're dealing with the uniqueness of everyone's physical baseline, and so the psychiatrist or the PCM, they're trying to dial in the proper dosage and the type of medication, because there's many different mechanisms that get after correcting some of these neurochemical imbalances. But I strongly support medications, and there's nothing wrong with taking medication. You don't have a problem taking medication if you got pain.
That's true.
Or some other physical injury. So what's the difference between that and taking medication if your body is not producing the chemicals that's necessary?
That's great. I'm sure that's going to help a lot of people.
I think so too. I think it'll help a lot. So can you tell our audience what's the difference between clinical depression and that is situational?
Right. So there's the situational depression. Someone who's going through a divorce, or someone who's filing bankruptcy, or someone who's went through a disaster, a hurricane or something like that. So your appraisal of that is going to be along the lines of loss. And so situationally, you're responding like any normal person would, from a situational factor. But then from the internal or endogenous kind of frame of reference, again, there's a physical limitation with your body producing those chemicals. And so biologically, you're just, that hardware is not what it needs to be to maintain a healthy perspective.
Good. All right, last thoughts. And this one's a little bit personal. You don't have to answer it. Do you have any personal stories that you could talk about around dealing with depression or anxiety? How you or someone close to you work through it?
Like you said, you don't have to answer it, but we would like to hear.
Right. Well, I mean, I see a lot of patients, and definitely, lots of soldiers I have seen, and every encounter is sacred, and is very valuable. But when I get the opportunity to see people that I've seen clinically, and they are doing well, and they're still continuing to contribute that's refreshing. Where
good.
you know someone's come in and maybe you know at their wits end in terms of their life, and then you know had a soldier who recently PCS'd and was at a point of you know just wanting to give up and get out of the army, and then the person got promoted to the next rank and was PCSing and still looking forward to contributing to the army. That was quite refreshing, and you know no amount of pay can kind of compensate for just it's you know that type of payment where you see someone and you help to improve their functioning.
That's awesome.
That's so good. That's
Yeah.
inspiring. Good. Well, last thought before we shut it down. Is there anything you want to say, or anything you want to just say in closing?
I would say that you know this has been an extremely stressful year with the pandemic, and you know just sort of living at this high level of stress and concerns, and you know would say that there's an aggregate effect of stress. So you know if the pandemic, workplace stressors, you know we have to be able to recognize our limitations, and not there's nothing wrong with saying you need to take a knee and recover. Self-care is very important, and knowing when you need to take a break and have that moment. You don't have to be Army strong 24/7. That's just not realistic.